Addiction's a really, really isolating disease.
With shutdowns and social distancing, increased loneliness has become a byproduct of the pandemic. But for those in recovery or in active addiction, that isolation can make things especially hard. Dr. Kenneth Azuha is the director of the Addiction Division in the Department of Psychiatry at UNMC. He says he's noticed more people asking for their services and more people seeking hospital treatment for withdrawal.
I think that we probably have seen, or I have, an increased number of patients who have lapsed, who had were in recovery and end up unfortunately going back to using their substance of choice.
Dr. Zuha says alcohol is the most widely abused substance in the area. Nationally, data from Nielsen shows alcohol sales grew by 54% in the third week of March compared to last year.
I think that isolation and then the stress increase the number of people that unfortunately have lapsed. But people are also working really hard to find recovery as well.
John Duggins, an addiction and mental health therapist with CHI, says there's still various resources out there for those struggling.
We are seeing just a little bit more of a rise in agencies such as this being more open. You can come in, like we have a walk-in clinic. You can come in, get evaluated.
Support groups are still meeting, both in person and online.
Things like the 12-step programs, Alcoholics Anonymous, Narcotics Anonymous, we're seeing a little bit more openness, I would say, but there's still a lot of Zoom availability.
These are tough times that we're in, and making sure that you're not isolating, you're not falling deeper into your depression or anxiety. Reach out for that help.
Kathy Johnston is the executive director at Valley Hope of Omaha, an addiction treatment center. She says reaching out for help is nothing to be ashamed of.
Nobody has to die from this disease, and nobody has to struggle alone from this disease.
Reporting in Omaha, Danielle Meadows, 3 News Now.